So thank you. And it's my pleasure now to move us to the last session of the day and to hear from the two remaining countries in the trio for the EU presidency. So first up is Nick Snyder from Germany, who will talk about the European Health Data Space, digital health in Germany's presidency. Nick is the head of division for new technologies and data use at the German Federal Ministry of Health. He was born and raised in Latin America, studied medicine in Heidelberg, did a postdoctoral fellowship in health policy research at the University of California, which I think makes Nick eligible for the title of a citizen of the world. It's a pleasure to have him. He's a big specialist in GDPR. And I'll now hand over to Nick to tell us what Germany's been doing. Thank you.
Thank you so much, Brett. And well, good afternoon to all of you out there in the virtual room today. It's a pity we can't meet in person, but I'm trying to give my best to present a bit what the plans are and were during our presidency of the Council, the second half of 2020, which has been a challenge to all of us wherever we are. COVID-19 has literally shown us how important health data use is and how needed a European health data space is, especially with regard to access to health data vis-a-vis a crisis like the one we are seeing at the moment. Next slide, please. I would just give a few introduction on why actually the issue of health data and the European health data space were so important for the German presidency, and look a bit back about the motivation we had for bringing this up on European level, even before the COVID-19 crisis hit us and made it even more evident. Then we'll bring you through our actions within the presidency, which were mainly aimed at build a political momentum towards the European health data space, and then wrap up with moving forward the actions we are foreseeing for the next years to come. Next slide. So why was this important to us? Many of you know that Germany has a very special relation to data protection and data use, and many problems or challenges we are seeing right now on European level vis-a-vis the GDPR we are experiencing within our own system when it comes to federal systems and state legislature governing health data use. So what we saw is that although we do have quite well working general data protection regulation within the health and healthcare sector, there is not yet a real free flow of health data. This was especially visible during the ongoing COVID-19 pandemic. The GDPR regime is too complex, especially for researchers, but also for industry and other actors. We do have different layers of law, which is European legislation, being it the general legislation and sectoral. We have federal legislation, especially in the health sector, and in some cases, like in Germany, even state legislation. And that makes it extremely complicated for researchers to navigate a system and know under which conditions they can actually work with health data. This led us to the sentence with our state secretary on Wednesday last week said that we have the problem, or we have the beauty in Europe, that persons and goods can easily cross borders. So do viruses, but unfortunately data, especially health data, stays trapped within the member states. And that's something which we have to jointly work on and where we actually can do better. So what are the shortcomings we identified in the last 2 years? First of all, there's a lack of consensus within the member states on the scope of national derogations of the GDPR, the definition of anonymization, pseudonymization, the regulations for primary and secondary use of data. We do use different legal bases for data collection, especially for scientific and research purposes. Some countries still or work with consent. Consent is a very important tool for scientific research. Others already have special derogations in national law, which allow health data be used in the public interest for certain research purposes. The rights to data subjects are mainly governed differently between member states. The different technical organizational measures and semantics and data quality still differ across the Union. And I think those are issues which are foreseen in the GDPR. I do have, and there's a very valid reason for those opening clauses in the GDPR, but because in the end, any healthcare system we have is a data processing system. And data processing systems should be interoperable, but due to the different history we have with our healthcare systems, they develop in different directions and are governed differently. And I think that is rightly so. We will not work towards a harmonized European healthcare system, but we should make those systems interoperable. And I think our main task is now to look at what could we do to overcome those challenges we identified. Next slide. So one idea we had at the beginning of actually last year already was to look at how can we actually establish a strategic approach to the European health data space. We all share the same common goal and vision, which is we want to have the maximum health for a population in Europe. We share the same principles, which are we do want trustworthy, high quality artificial intelligence being used in the healthcare systems. We do want to ensure a free flow of data across the Union while preserving data protection. And we want to see Europe competitiveness on global level. How can we reach that? We will need to have very concrete actions. One is the foreseen regulatory framework for AI, which is something which is currently being developed by the Commission already and where we do have high hopes for. Second big point is going to be the establishment of interoperable and communicating health data infrastructures. I say deliberately infrastructures because I don't believe there's going to be one size fits all solution to it. We do have infrastructures for research, different ones for healthcare, and some for secondary health data use. And I think that's right to have different infrastructures, but as we have it in a transportation field with different roads and different systems, we need to be able to navigate those and reach from one to the other. The third important point is the one which is going to be dealing with everything which is governed by the GDPR, but prone for different interpretations by data providers, by data processors, by data protection authorities. And I think those issues, which we can't legislate because they are actually already dealt with in the GDPR, but need interpretation, could actually be broken down in tailored codes of conduct for health data use, especially when it comes to secondary health data use. And I think the codes of conduct are an instrument which haven't yet been sufficiently used and could be a hope for the future for us if you want to overcome those different kinds of understandings in the member states. Next slide. So what happened in the early 2020, together with the Commission and chaired by it, we conducted a series of 5 workshops to assess what the member states' rules on health data are in light of the GDPR. And we identified possible areas of European action together with the Commission. I think that was a very worthwhile endeavor, which started still as an in-person meeting in January in Brussels, but then due to COVID-19 moved more and more into the virtual sphere. And in the end, instead of 3 in-person meetings, we had 5 virtual meetings, which then also dealt with COVID-19 and the needs we were seeing on European level and what could be done. And I think that was a very good exercise to present what is going to come in the next couple of years. We're still waiting for the final report. So once more, a plea to the Commission to finally print it. We know the draft is there, but we want to see it written to be able to also divulgate it among the European member states and all the stakeholders out there. Next slide, please. So what did we do in the German presidency? One big step was, of course, to learn from the mapping study and the workshops. We also wanted to bring this to a higher level and discuss it on ministerial level. We had an information point at the informal meeting of health ministers in July this year, a point which was well taken amidst the COVID-19 crisis. We explored the issue and discussed it with a variety of stakeholders last week at the high-level conference, Digital Health 2020, You and the Move, a very successful event in which we also saw that many ministers could be joining in by either greetings or in person We had, I think, 5 ministers in panel discussions. We had the commissioner there. We had the European Data Protection Supervisor, and we had the president of Estonia in the final political debate. So it was very good to build the momentum, especially among member states, but also within stakeholders for the European health data space, and to show the necessity we have to do more on European level, to share data and get access to them. Next step for us is now to include all those visions and points in Council conclusions. We are preparing Council conclusions on COVID-19 lessons learned, and we will have a special chapter on digital health and health data use in there. So many recommendations will actually be included in those Council conclusions. I'm quite positive that although we didn't finalize the text there yet, that is going to have strong language for health data use in Europe. And we started together with especially the Finnish leadership, the joint action on the European health data space, which should start beginning of next year. So that's a work to be done for the next 2 years to establish first suggestions for how our governance could look like in Europe. So what we did was mainly to build a political momentum for the European health data space. And I do think that we are in a rather good way here, and we hope to then give the baton to our colleagues and friends from Portugal to continue the good work on digital health. They are very experienced in this field already, and I do know that with their leadership, we can bring it to a whole new level in the future. Next slide. So what is our vision for 2021 and what's our vision for 2025? Together with the Commission, we presented it last week at a conference. We do know the Commission is going to present a legislative act on the European health data space in 2021. We are starting the joint action towards European health data space with 22 member states under the leadership of Finland. There's going to be sufficient funding through the EU for Health program and other EU instruments. We want to see strong engagement from all relevant actors, also those participating today here, to develop targeted codes of conduct for secondary health data use. And we will hold the Commission accountable to provide funding for those code of conduct. And we will urge the Commission to start with first pilot projects to demonstrate the feasibility of cross-border analysis for healthcare improvement as soon as next year. So I think there's a lot to be done from the Commission, from the member states, and for all actors involved in healthcare next year. Our main aim is that we, by 2025, do have an interoperable data access infrastructure to facilitate secure cross-border analysis of health data. And now, if you're wondering why there is a picture of a house besides those numbers and words, well, that's how we envision the European health data space. The European health data space is not a vague science fiction cloud thingy running over us. For us, it is a well-formed, structured house with all those instruments we have on the right side of the slides. We are building the foundation, we have the bricks, we have the architecture built, and in the end, the European health data space will serve different purposes and different actors. And we do need to see this in form of a house where any of the relevant stakeholders will have their own room. There's going to be a room for the patients to access their data, to manage their data, to manage consent. There should be another room for healthcare professionals where they can manage the relevant data they need to treat their patients. At the same time, there are going to be rooms for researchers and research institutions to access aggregated health data for certain purposes. And there should also be a room, a very transparent room, on how industry could take access for some of the data provided, especially in aggregated form, and anonymized and on all the safeguards. And I do think that such a house as an infrastructure for secondary health data use should be transparent. We need to have big windows that everybody can look in and see what is going on there. And it also needs to have a very clear foundation and structure. That's why this analogy of the house worked quite well last week. And actually some of the actors even thought about considering going from EHDS house to a whole city, which we could be planning. But that's something for the time after 2025. So far, I think we have a big task to build these EHDS as a house. And I do think that together we can achieve a lot in this. Next slide. Just a short reminder for those who were not involved yet. There is a joint action starting beginning of next year. It's going to be led by Finland. It's built on 4 main pillars. One is governance, one is data quality, one is infrastructure and capacity building for member states. There are 22 member states already involved, plus 4 non-member states. I do think that we have a strong basis for European health data space with such a devoted group of member states already involved. We're going to try to align the joint action with further activities like the ones in the eHealth network, like Gaia X, which currently has a summit running in parallel to this summit, and with the code of conduct processes. Whole action will start in the first quarter of next year, and I do believe that we have 2 years' time to come up with strong recommendations for governance infrastructure, which should already be feeding into the Commission work as of day 1 of the activities. Next slide. The codes of conduct, as I said earlier, should be tailored for specific categories of data processors and processing situations. They shall be developed by the actors, not by governments, but it's the role of the Commission and member states to provide respective funding and to ensure that those codes of conduct are well developed. They should provide legal clarity and especially guidance for those which at the moment are lost in translation, somewhere when they want to deal with health data use in Europe, but don't know what actually is valid for them. They could be applied in all those areas which currently are not really available for EU legislative action. And those places are actually especially health research, secondary use by industry and other fields which are governed directly by the GDPR. Next slide. The third, and I think for us the most important point, is we need to have more cooperation between the member states. We need to reduce the differences in the interpretation and implementation of the GDPR. We need to exchange best practices, and we need to enhance data quality and make it findable, accessible, interoperable, and reusable. In a sense, our systems need to communicate to each other and need to be interoperable. This cannot be done in a one-size-fits-all version. This can also not be done top-down. I think we have to start with a bottom-up approach. We have to foster use cases of health data spaces for specific research topics and scale from there. This is something where we see also the Commission and other actors in the role of harvesting and fostering respective use cases and starting with real projects with added value. We also need to demonstrate to the citizens out there that actually there is not only a beauty in transferring data, but there's a need, especially in personalized medicine, in cancer, in rare diseases, where all of our member states maybe are not, they may be too big to fail, but they're also too small to shine. And I think that's where we actually have to work together, especially within the European Union, to get data together, to use European data. We can use European data very well for training algorithms in artificial intelligence. We can't rely on data from other areas, and I think that's something which we can do better and we should do better. And I think there is a role for the European Union to play here. Next slide. So just to summarize in the end, as you probably saw, we are committed to do something. We want to see the European health data space become a reality. And in Germany and also in Europe, we are on the move. And I think with that, I want to finish up Digital Health 2020. COVID-19 put us all on the move. And I hope that the German presidency helped at least to get health data use in Europe one step further. Thank you very much.
Nick, thank you for that very lucid and fast-moving explanation of what Germany has been doing, and in particular in relation to the presidency. If it's possible, if I can ask you just a couple of questions before you depart. Thinking back to the draft council conclusions on COVID, do you think that those conclusions will separate out, if you like, so sharing knowledge about pathways and how drugs work and so on, And then finally, do you see it as so it's research, treatment, and public health? So how you use the data in terms of being able to track and trace and that type of thing. Will it cover those?
If I look at the current text, all three areas are actually included there. Approach towards it, and for us, it is especially important to use data for research purposes, for healthcare improvement, and also for public health.
Great.
An additional issue which we are also looking at is innovation in general. How can we use health data to bring innovation forward? So that's a third one, which is not only looking at scientific research, but also research conducted by and with industry.
And if I had to press you and say, which reform or change do you think is most important to, if you like, power the European health data space? What would that be and why?
Especially looking at Germany, I would say the most important reform is a reform in mindsets. What we do need is to get away from just seeing data use as a risk, but also seeing that there actually are ethical implications of not using data. And that not using data can be as dangerous as actually abusing data. And I think with that in mind, we do have to, yes, we do need data protection. We do need value-based, trustworthy data use systems. And I think that's a big advantage we as Europeans have. I think there is especially for areas with sensitive data like the health sector, we might have a second mover advantage compared to other markets. And because we have this strong regulation already for data protection, I do think that when it comes to trustworthy AI, for trustworthy health data use, there's a lot we can be doing. But we need to get away from just thinking that data use is a risk, but we have to see the opportunities and chances. And I think that's something where we can still do better in Europe.
And that chimes with a conversation that we were having this morning about balancing the risks with the benefits and risk stratification, if you like. There's one question from one of the audience. It says, Nick, how would you accommodate the codes of conduct? Would there be a dedicated call or a project? How do you see that?
Without going too much into detail on what's going to happen, I see this rather as a call for projects within the EU for Health program. Because in the end, it's going to be the data processors who should be developing codes of conduct. So it's not an activity I see which should be done by governments. It should be done by the respective data, or by the associations representing the data processors, or by the processors themselves. So I would see the right instrument would be a call for proposals and have a good project running on a European level to develop them. And in the end, get them past the data protection authorities.
So I think you were saying that the role of government and the Commission in that case is funding the development of that.
Is supporting, and ideally, I would also say funding, yes. And we actually included a plea for EU for Health to also cover the cost of codes of conduct. Because in the end, especially if we look at research institutions, if they want to have a competitive edge against other players which are highly and well-funded, we need to have neutral funding for them. Otherwise, they will be interested and biased.
Yeah, and there's a question from Angel Martin from Johnson & Johnson, which is, do you foresee the role for regulatory sandboxes in the development of the European health data space?
I do think that they could be an instrument to be used. And I do think that there should be room for testing and experimenting within certain safeguards. Of course, we will not open all regulation for that, but I think we saw that regulatory sandboxes are also working now with COVID-19, and in the long run, we might need to be creative.
Great. Well, thank you again. We really appreciate the insight that you've given to what the German presidency has done and the results of the high-level conference last week. Very grateful to you. Thank you.
A pleasure.
So that leaves me to now introduce the last member state to be talking, but who will hold the presidency very shortly, and that's Portugal. So the introduction is to Luis Goes Pinheiro from Portugal, who is the chairman of the board of directors of the shared services of the Ministry of Health in Portugal. And I'm delighted to say that he is another lawyer. So it just goes to show that lawyers are very, very, very adept at multiple skills and roles. So over to Luis. Thank you.
Thank you very much. Thank you for having me here. I'd like to congratulate the Digital Health Society for organizing this event. And first of all, I'm not sure if Nick Schneider is still there, but I'd like to congratulate the German presidency for the excellent work it has done in such difficult times. We all recognize that, and thankfully it happened. And the work that we all, the trio of presidencies, have been doing in such difficult times, it's really important. I'm going to talk about what we have been doing in Portugal and what we are going to do in Portugal for the next years in what concerns the digital transformation in the health area. And by the end of my presentation, I will speak about our priorities in what concerns the coming presidency of the European Union in the next semester. Let me just share with you my presentation. There we go. Okay. So, in what concerns the digital transformation in the health area, we in Portugal, we are working in four, we can say four big pillars. On one hand, the infrastructure, on the other hand, the information systems related to professionals, on the other hand, the information systems for citizens, and finally, the health data that we have heard a lot in the previous presentation. In what concerns the infrastructure, our goals are three major goals: to increase performance, to streamline management of those infrastructures, and increase security and business continuity. So the actions that we are going to take in the next years are: we are going to renew our data centers and workstations. We are going to centralize infrastructures. During my presentation, I will say a lot that in this area nowadays less is more. Less is more. We have several small data centers, several small infrastructures. We need to concentrate them in order to guarantee that the management of those infrastructures are better, and to improve that management, and to guarantee more security, and to really develop a truly and strong business continuity plan that depends for sure on having less data centers, but with other infrastructure behind it. And for citizens as well, we'd like to guarantee that every NHS user have Wi-Fi available for them in order to make them feel a part of the system, and more a part of the system. So what concerns what we have been doing in infrastructures, we just finished the migration of our data network for a renewed one. We now have optic fiber in every infrastructure of the health sector. We are talking about around 2,000 locations that now have a minimum of 40 megabits per second. And when we are talking about hospitals, of course, we have at least 500 megabits per second. And this is something that started during the pandemic crisis. It started in May, and it was ended in August. So, and it's really important to guarantee that we have these highways of information serving our health infrastructures and our health locations, in order to guarantee that you can put on top of them the systems that we'd love to have in the future. And besides that, we have been doing a big effort in order to improve the working stations of our health professionals. We're talking about mobile phones, and even other infrastructure. And we have been delivering mobile phones to them during this crisis, and you can imagine why. And we are going to deliver around 30,000 mobile phones to our primary care professionals. In what concerns the user Wi-Fi that I told you before, it's called Wi-Fi utente in Portuguese. We already have 1,700 locations with Wi-Fi available for our NHS patients, users, and they have been using it, of course, as you can imagine. In what concerns the local networks, because the truth is that we managed to deliver big highways to our healthcare locations, but inside of them we still have, especially in the primary care area, we still have some of them that need a lot of modernization. So we have been working on it. We now have several acquisition procedures, or at least one acquisition procedure with different where we are going to acquire different systems in order to guarantee the modernization of those local areas networks. We are going to do that by the end of the year, the beginning of the next year. We are going to end the acquisition procedure by the end of this year, and we are going to guarantee that everything is working by the beginning of the next year. In what concerns the systems for professionals, our goals are, of course, to simplify the work of our health professionals, to create conditions for greater mobility. If there's something that we learn from this pandemic crisis, is that people need to be able to work away from their traditional workplace. So we need to guarantee that every instrument is digitalized in order to guarantee the maximum mobility for the health professionals. We also need to facilitate and to guarantee access to users' information wherever the health professional is, and we need to increase and improve the systems that are available for helping the decision-making processes. And of course, that is based on data, as we all know. And we need, on the other hand, to increase institutions' efficiency, because the systems for professionals need to guarantee information, and on the other hand, need to guarantee actions for the managers in order to guarantee that everything works perfectly and smoothly and efficiently. And that's one of our goals in this area. And the actions in order to support these goals are the development of new information systems, not only for the clinical area, but also for administrative purposes and management objectives, of course. And this means, again, that less is more. We here at the shared services, we manage over 80 systems, 80 different systems. So it's really a huge effort in order to guarantee that everything works smoothly, and especially when we are talking about systems that are made up with different architectures, with different technologies. Some of them are already have been aging for the past few years. Some of them have decades. So we need to do something about it. Otherwise, our legacy is too heavy, and that's probably something that every member state, every country that jumped to the digital transformation many years ago are feeling right now. The legacy is heavy, So there are some decisions that need to be made, and some of them pass it through the replacement of the systems that we have right now, in order to guarantee that we have modern systems in some areas, and we need to take the decision to end some of them. And the new ones need to respect some technological and architectural and functional standardization. Here in Portugal, we have systems to serve the administrative part of hospitals, of primary care, and for clinical purposes, we have different systems, which is something that, of course, makes no sense. We need to evolve in order to guarantee that we have a similar core in every that responds to every needs of the system, and then have some parts of it that need to be specific and specialized, but the general core must be universal, as you can say this. And of course, we need to have higher performance, and more than higher performance, we need to have similar performance in every one of these systems. We need to, of course, increase interoperability, and in order to reduce repetitive tasks. We know that people keep doing in many times, too many times. They are the interoperability factor between systems. We know that people take information from one system, and sometimes it's the same person that puts that information in another system. We need to handle that, and at least till the time we have a system that answers to all the needs. And as I told you before, we need to develop the decision-making. We need to help the decision-making process by developing systems for that, not only for professionals, but also for the organizations. We need to intensify the development of teleworking tools and to promote telehealth tools, which of course are different. One intends to promote the mobility of the professional. The other one looks more to the mobility of the patient, the user, the one that is outside the healthcare unit. And of course, we are not going to start right now. We have, as I told you, more than 80 systems. I just selected here a couple of them. I'm not going to talk about all of them. So, and we came a long way, and we have several ones, but I'm going to speak about 3 of them. The S3 is a new system that we are working on. It was meant to serve hospitals, but the truth is that we are looking at it as the core of our national healthcare system. It's a system that is developed using microservices architecture. It's something that you think can last. It's future proof. So we believe in it, and we are going to extend it to several other areas, not only to hospitals, and we are going to use its architecture in order to replace with baby steps the other systems. And another system is Trace COVID-19, which was developed during the pandemic crisis, and it's quite interesting because it's the system that allows us to monitor COVID patients, and it was, of course, developed to do that. But nowadays, it's one of the most important tools in order to monitor the pandemic crisis here in Portugal. More than 12,000 professionals active with the system. We have more than 20% of our population already in it, by different reasons, but they are already in it. And it has been an impressive tool that allowed, for instance, doctors to monitor their patients at home when not only the patients are in their own homes, but also doctors during our during the time where everybody was confined, doctors were able to monitor their patients using this system. So it was quite useful and quite new in this approach of teleworking and telemonitoring. So it was a big telehealth tool and a big telework tool as well. We also have here a PEM, which is our electronic prescription tool that allowed us to prescribe already almost 300 million medicines. And we also developed our own teleconsultation tool during the pandemic crisis, which is RSE Live, and so on and so on. As I told you, we have more than 80 systems, so it's a lot. And of course, all those systems, some of them are going to be the base of the future. In what concerns citizen, our goal is to increase health gains, to facilitate access to healthcare, to create and increase equality in that access, and of course, to improve users' experience when they get in contact with the healthcare system. So our approach is it's an omni-channel model. We want to guarantee that independently of the door the citizen chooses to get in touch, to get in contact with the healthcare system, his experience is going to be similar. So if he get in touch with us by phone, by digital interface, or if it comes face to face, of course, I'm not talking about urgencies or emergencies. I'm talking about the daily functioning of our healthcare system. So it's for that omni-channel model. We wanted to guarantee that the experience is similar. And because of that, we have several portals, we have several apps, we have several phone numbers, and we are going to step by step migrate to one portal, one app, one phone channel, in order to guarantee that people know exactly what we have for them in all those channels, and to guarantee that we can, by managing well the one door, managing well the single door, we guarantee that the system is all well managed and serves effectively and with quality our demands. And on the other hand, we are in the course of developing more and better telehealth tools in what concerns especially telemonitoring. We are going to extend telemonitoring to every aspect of the healthcare system. And we are going to invest in the accessibility of the services, and we have been doing that as well. For instance, just to give you an example, here are 4 different apps that we have in Portugal. We are a 10 million, around 10 million people country, but we have the MySNS Carteira, MySNS wallet. It was already downloaded more than 1 million times. The MySNS was loaded more than 630,000 times. MySNS Temps as well, 88,000 times. And our new contact tracing app, Stay Away COVID, was downloaded around 2,600,000 times. But of course, this one, the last one, is it serves different purposes, and it must remain independent. But the others answer to more or less similar. They offer similar responses to different questions. So of course they need to be a single one. And the same happens with our portals. We have several portals, but especially 2 big ones. The the citizen area of our NHS portal and the NHS 24 portal. This one in particular is quite interesting because since January 1st, it had already more than 6.5 million people visiting it, different people visiting it, which is a lot. We're talking about, as I told you, a country of 10 million people, so it's quite a lot. In what concerns the phone channel, we are in our country we have the NHS 24, which is a call center, or the truth is that there are 7 call centers that work together in order to guarantee nowadays over 30,000 calls answered daily. So it's quite a lot. Since the beginning of the year, we already answered more than 3 million calls. And it has been a line really important during the COVID crisis in order to guarantee that people get some answer and some support. Finally, the last pillar is our health data, and we want, our major goals are to obtain more data, to increase data quality, and to reuse more and better our data. And the actions that we are going to take and that we have been already taking, it's the consolidation of our national registries. We're talking about the citizen registries, professional entities and documents. I told you before that we are going to develop new systems for citizens and professionals. So we are going to use those systems in order to generate data that can be reused. And we also are increasing and diversifying our collection points, especially in what concerns telemonitoring, but also another kind of telemonitoring, which is auto-report. And we also, of course, and I didn't talk about it when I talked about the infrastructure, but we want, of course, to increase the storage capacity, because we are already throwing away a lot of data because we just don't manage to store it. We want to build a real data lake of health data, and to share more open data, and to invest in artificial intelligence as a consequence. And what we have already going is we have 11 semantic catalogs, and we have 5 more in preparation. We already have 3 national registries, and we have been improving them: the person registry or citizen registries, the professionals, and the entities. Over those more than 80 systems that I've been talking about, we have 8 business intelligence systems generating information. And we also have a transparency portal where we have open data accessible for everyone, and we have more than 140 data sets of open data. And we have been working with the Academy in 6 different artificial intelligence projects. One related to antibiotic prescriptions, the other one for helping regulate the emergency demand, the emergency services demand. One for cardiologists and the other one for dermatologists. And Scout AI is one for helping NHS 24 to work better, our national call center. And Frail Care AI is one for the elderly. As the name tells, Frail Care is for them. So as you said before, at the beginning of my presentation, you said it, Portugal is going to be in the share of the European Union for the next semester. It's going to start on the 1st of January, and as the trio of the presidencies that started with Germany and is going to end with Slovenia, established digital transformation as a key priority for the health sector. And I'm really glad we did it, because it's true that the context has been changing, but the essentials remain the same. And we live in difficult times, as we all know, and the pandemic hit the world with great impact and violence, and it's now striking again strongly, and Europe is suffering from it right now. And it's as I said before, we all have seen that if there's something in the digital transformation area that stood out during this pandemic crisis is telehealth. So we'd like to select telehealth as our main theme for our presidency, and a common element for several actions that we're going to take during the next semester. First of all, we'd like, I can't predict the future, of course, and I will not try to do it, but we hope that by the end of the semester, and by the end in June, it would be possible to get together again like we used to do in the past, and to and to organize a major event in Lisbon dedicated to telehealth, to the interoperability of health records, and to data reuse. And besides that, in the context of that event, to organize the 19th e-health network meeting. I'm not already sure if it's going to be held before or after the e-health summit, and if this e-health network meeting is going to happen or be held in Porto or Lisbon. But well, nowadays we are just it's a wishful thinking that by then we are going to be able to get together and organize something in face to face. We'll see. And we'd like that the main outcomes of our presidency to be the adoption of a political statement that would give a decisive push to the elimination of barriers to cross-border telehealth and the circulation of health data in European territory. And on the other hand, we'd like that this political statement would be accompanied by a cross-border telehealth proof of concept carried out by a couple of states that adherent to the initiative. And we're talking about technical proof of concept to serve as a motivator to trigger, to boost future developments in this area. So these are our priorities for the upcoming presidency, and of course, without prejudice, to giving continuity to the initiatives of the German presidency, which in fact are very much in line with our priorities. So thank you very much. Thank you again for the thank you again, Digital Health Society, for having me here, and I hope I'm here for answering all your questions. Thank you.
Luis, thank you very much for a tour de force around the Portuguese health system, and for considerable clarity around what you intend to do in digital health during your presidency. I'm conscious of time, So if I can move us on to close on time, if that's okay with you.
Yeah, okay.
I think that I was very heartened by the collaboration that's taking place between the trio and the continuity in terms of developing digital health services for the citizens of Europe, and for the obvious ways in which the baton is being passed, and for the common goals around the European health data space. And this morning we were listening to the Secretary of State from Slovenia, and it's also quite interesting how the countries and some of the systems have very similar goals that they're doing, which perhaps should not be surprising to any of us, that you're all engaging in similar initiatives, for example, around the registries and telehealth. So it was fantastic to hear that. I think the obvious link between the digital single market, if you like, and the European health data space has been another theme throughout today, as has the need to share knowledge and drive collaboration, greater collaboration across borders. I like to say healthcare knows no borders, and the pandemic, if nothing else, taught us that, and the need for solidarity between the member states to tackle these initiatives, and how important digital health and digital health tools are in helping us all do that. And I'm sure that all the audience listening would dearly love to be able to go to Portugal in June, have some sun, and go to your 2 events. There'll be a big queue, I'm sure. Yeah, exactly. Thank you. So I just want to bring the event to a close today, and just say a couple of things about what we've heard. So the DHS and the EHDS calls for action, I think, link a lot to what Portugal is going to be doing in its presidency. And Luis, we'll be in touch with some of our results and to talk to you about how you may be able to help, or we may be able to help you move some of that work on. For all policies for health, I'm sure that if any organizations amongst those who are attending are interested in becoming knowledge partners or corporate knowledge partners, please see the exhibition space and get involved. We've touched on what on the presidency, so I'm going to just say that the panel on empowering citizens and governance models was fascinating, and I thought that they clearly all agreed that they want to work together more, that they've got things to do and to share knowledge. And I'm sure that the Digital Health Society will try, along with EHDS, to facilitate that. I was heartened to hear about the innovation in the German ecosystems and ECH Alliance ecosystems that have formed this year. Germany, as the largest market for digital health services, it's fantastic to see how it's now becoming a game changer in terms of its approach and the reforms that have taken place. And it was very refreshing that Nick was explaining about some of the previous privacy and challenges in that market and how that is being resolved. The innovation showcases around open data platforms for services, for health services and research, clearly key to the free flow of data. And then the digital vaccination service and the ability to perhaps allow us all to start traveling again because we've had a vaccine and we can prove that we've had it, has obvious benefits for society in general and for individual countries. And then finally, tomorrow we have another half day with my colleague Valentina Tiago, and another great lineup with online training for digital health, investments for data health and care solutions, and the benefits and risks of AI for health and well-being in the workplace. So please join us tomorrow morning for the remainder of the Digital Health Summit. And again, thank you all for your contribution. Thank you for all the speakers, and I wish you a good night. Thank you.